Gentlemen, I want you to imagine waking up tomorrow morning with a firmness you haven't felt in years. No pills, no pumps, no risky treatments. Just the use of your hands and a few minutes of simple, precise stimulation to awaken your body's natural erection mechanism. I'm Mr. SOPHIA US, with 15 years of experience helping men regain sexual vitality. And today, I'm going to show you 3 specific pressure points on and around the penis that can help restore morning erections by improving blood flow, relaxing the right muscles, and enhancing nerve responsiveness. Asterisk, if you've been missing that automatic morning wake-up, stick with me, because by the end of this video, you'll know exactly where these points are. How to stimulate them safely, and how often. To do it for real results. Before we get into the where and how, you need to understand why this works. Because once you know the science behind it, you'll realize you're not just pressing on skin. You're tapping into one of the most powerful systems in the male body. Erections are not random or mechanical. They're the result of a carefully coordinated dance between your brain, your spinal cord, your blood vessels, your nerves, and your muscles. It all begins with a nerve signal. Tiny electrical messages travel at the speed of light from your brain or sensory nerves to the erectile tissue. Asterisk, those signals tell the smooth muscles inside the penis to relax, allowing blood to flow in and fill the spongy chambers called the corpora cavernosa. As they fill, the veins that normally drain the blood are compressed, trapping the blood inside and creating firmness. Now, here's where age changes the game. Over time, the blood vessels in your pelvic region can harden due to a reduction in the elasticity of the artery walls. A process that is accelerated by years of wear and tear, mild inflammation, or conditions, like high blood pressure. At the same time, nerve conduction slows down, meaning those electrical messages from your brain or sensory receptors don't travel as quickly or as strongly as they once did. This 1-2 punch sluggish circulation and weaker nerve signals is one of the main reasons morning erections begin to fade after age 50 or 60. Asterisk. Targeted pressure point stimulation works because it sends an immediate wake-up call through your nervous system. When you press or massage a specific point, you activate clusters of sensory nerve endings that lead directly into the reflex pathways involved in erection control. These signals aren't just local. They travel to the pelvic nerve plexus and even up to the sacral region of the spinal cord, which houses the erection center. This triggers a chain reaction. The nervous system tells the smooth muscle in the penis to relax, arteries to expand, and blood to circulate more freely. But it doesn't stop there. Some of these points also have a direct effect on the pelvic floor muscles, the hammock-like muscles that support the penis during an erection and help control ejaculation. Asterisk, stimulating them can improve their tone and responsiveness, making it easier to maintain firmness once you have it. This is why the effects of pressure point work are often two-sided. It can help make it easier to initiate an erection and also help you keep them for longer. When you press or massage the right points, you're essentially bypassing some of the age-related slowdown and giving your erection system a direct hands-on boost. Think of it like a computer reset, clearing out the lag, refreshing the signals, and letting the hardware and software work smoothly again. Done consistently, this type of stimulation can retrain your erection reflexes, improve the flexibility of your blood vessels, and even enhance nerve sensitivity over time. Asterisk, the first point we're going to target is called the base groove, and it's located right at the root of your masculinity, the exact spot where the shaft meets the pubic region. To find it, glide your fingers along the underside of the shaft towards your body. You'll notice a small groove or indentation, almost like a natural hinge where the erectile tissue blends into the deeper structures anchored in the pelvis. This area might feel slightly different from the rest of the shaft, a little firmer or more textured, and that's because it's the meeting point of important anatomical structures. Why is this spot so crucial? Beneath your skin, here lies a dense network of sensory nerve endings. including branches of the dorsal nerve of the penis along with major blood vessel junctions that feed directly into the erectile chambers. Asterisk, think of it as a control hub where signals from your nervous system and your circulatory system converge. By stimulating this area, you are essentially lighting up both your neural pathways and your vascular system at the same time, encouraging better communication between your brain, your spinal cord, and your manhood. When you apply a gentle yet purposeful circular motion to the base groove, you're sending two important messages to your body. First, you're telling your blood vessels open up and let more flow through, which helps to enhance circulation. Second, you're telling your nerve fibers wake up and be ready to transmit signals more efficiently. This combination primes the erectile tissue to respond more quickly when a stimulating signal arrives, whether that's in the morning or later in the day. Asterisk, here's how to do it right. Position your thumb directly on the base groove while your fingers cradle the back of the shaft for support. Start with moderate pressure, just enough to feel the tissue beneath your thumb, but never to the point of pain. Make small, slow circles, letting the warmth of your touch gently spread throughout the lobe, the area. As you work, you can gradually increase the firmness of your pressure, especially if you feel the tissues begin to soften and relax. You may notice a pleasant warmth, a mild tingling sensation, or even a sense of fullness beginning to develop. Those sensations are your body's way of telling you that blood flow is increasing and your erectile tissue is becoming more responsive. Asterisk, if you don't feel much at first, don't worry. Consistency is key. Over time, a daily practice will heighten the sensitivity in this area and make the results more noticeable. For best results, work on the base groove daily in the morning. Ideally, before you get out of bed when your body is naturally relaxed. A warm shower is another perfect time, as the heat will soften your tissues and improve blood flow. Over weeks, this simple yet precise technique can retrain your erection reflexes, helping to restore those strong, reliable morning erections you thought you had lost. Asterisk, the second point we're focusing on isn't actually on the shaft, but in a slightly obscure, often overlooked area, the perineum. This is the soft, slightly springy patch of tissue that lies between the scrotum and the anus. Many men ignore it entirely, but in terms of erectile strength and control, it's an absolute powerhouse. Why? Because it lies directly over the bulbus spongius muscle, a key player in maintaining hardness when you're stimulated. The bulbus spongius muscle is one of your main pelvic floor muscles, which is responsible for trapping blood inside the penis during an erection. Think of it like a natural clamp that keeps blood from escaping too quickly. Asterisk, over time, especially with age, this muscle can weaken if it's not actively engaged, making it harder to maintain a strong erection. By applying targeted pressure and massage to the perineal area, you can reflexively activate this muscle, essentially giving it a workout without even doing a full set of Kegels. To locate it, either sit in a comfortable chair or lie on your back with your knees slightly apart. Use 2 fingers, typically your index and middle fingers, work best. Press gently but firmly into the center of the perineum. You're not pushing hard enough to cause discomfort, but just enough to feel the muscle underneath respond. Move your fingers in slow, purposeful circles, staying right on that central sweet spot. As you massage, you may notice subtle sensations developing. Perhaps a gentle warmth radiating toward your penis or a faint pulsation as blood flow improves. That's your pelvic muscles waking up and your circulation responding. Spend 2 to 3 minutes here, keeping your touch steady and controlled. For an extra boost, pair this with gentle pelvic floor exercises like Kegels, either before or after the massage. This combination doesn't just help in the moment. It trains the muscle to contract more powerfully during stimulation, making your erections feel fuller and more reliable over time. The perineum may be out of sight, but when it comes to restoring morning vitality, it should never be out of mind. Asterisk, the third and final point is located in one of the most sensitive anatomical regions of the male, right below the head of the penis. This is called the glans. And more specifically, we're targeting the ring-like ridge where the glans meets the shaft called the corona. This area is packed with an extremely dense concentration of sensory nerve endings. These nerves are your body's main messengers, sending signals of arousal to the spinal cord's erection center. When this point is stimulated with the right balance of pressure and rhythm, it can boost nerve responsiveness, making it easier to transition from arousal to a full erection. It's almost like tuning your body's electrical circuits so it responds more efficiently when the time comes. Asterisk, this point works best when the stimulation is controlled. Too much intensity here can overwhelm the nerves and have the opposite effect. To work this area, gently grasp your manhood with your thumb and forefinger, positioning them on either side of the corona. Gently pinch the ridge and hold for about 5 seconds, then slowly release. Repeat this hold and release action for about 1 minute, making sure to keep the pressure firm but comfortable. Afterward, transition to slow circular motions around the entire circumference of the corona, letting your fingers glide just enough to stimulate the nerve endings without causing friction, irritation. Asterisk. This second minute of circular work helps to awaken the sensory pathways even more, encouraging faster signal transmission between the penis and the brain. Over time, consistent stimulation of the coronal ridge in this moderate, rhythmic way can lead to stronger, more frequent morning erections. You may also notice an overall improvement in sensitivity during intimacy, making arousal feel more natural and spontaneous. Remember, this isn't about overwhelming the nerves. It's about gently restoring them to respond the way they did when you were younger. Think of it as a daily reminder to your body of how good circulation and nerve coordination are supposed to feel. Asterisk, the best results will happen when you treat these 3 points not as separate procedures, but as part of a deliberate routine. Here is the sequence I recommend to my patients for maximum benefit. Start with the base groove for about 90 seconds, making those small, steady, circular motions until you feel the area warm and responsive. Then move to the perineal point for 2 minutes, pressing and massaging in slow, purposeful circles to activate the pelvic floor and encourage deeper circulation. Finally, finish with the coronal ridge for another 2 minutes, using that hold and release technique followed by gentle circular strokes to awaken nerve sensitivity. Asterisk, done consistently. This sequence stimulates blood flow, activates muscular support, and sharpens nerve communication. All key factors needed for firmer, more reliable morning erections. Now, I want to set the right expectations. This is not a magic button that transforms everything overnight. Your body needs time to adapt, to retrain those blood vessels, muscles, and nerves to work together again. However, many patients begin to notice subtle but encouraging changes within just 2 to 4 weeks, and improved warmth and fullness in the mornings, an erection that lasts a little longer, and a general sense of increased vitality in the pelvic region. Asterisk, for real long-term improvements. Pair this daily pressure point routine with healthy lifestyle habits. Staying well hydrated throughout the day helps keep your blood volume and circulation at their best. Keep your pelvic floor healthy with exercises like Kegels to supplement the firmness you'll notice from this technique. And don't underestimate the power of nutrition. As you make these steps a part of your daily rhythm, the benefits tend to compound. The points become more responsive, circulation improves, and your body begins to remember how to do it the way it once did. It's about creating an environment where strong, natural erections can happen more easily and doing it in a way that's safe, drug-free, and completely within your control. Asterisk, gentlemen, you don't have to accept weaker or vanished morning erections as a normal part of aging. Your body is still capable of responding. It just needs the right stimulation and support. By pressing these 3 points daily, you can retrain your nerves, restore circulation, and bring back that morning confidence without pills or risky procedures. If you found this information helpful, make it a part of your routine and let me know how it works for you. And remember, your sexual health is a reflection of your overall health. So every step you take towards better circulation and firmer muscles will pay off in the bedroom and beyond.